Welcome everyone. The title of my PhD thesis is Mechanical and Optical Properties of Enamel and Dentin. My name is Péter. I'm an MD PhD student from Department of Prosthodontics. Our supervisor is Emese and my SMS is Cindy. My vision with my PhD work is to help to define dental aesthetics with the academic language of science, and my mission in that is to specify what natural looking means scientifically. And for the sake of this goal, I would like to present to you my two projects. The first one is investigation of the effect of teeth whitening on enamel structure, which is a comparison of in vivo studies by the methodology of systematic review and meta-analysis. And the second one is also closely related to tooth whitening, but it is a comparison of in vivo studies. But at first, let me tell you about my first project. According to a survey published in the Journal of American Dental Association in 2023, almost 90% of more than 400 patients hide their teeth while smiling because they are displeased with their dental aesthetics. More importantly, almost 60% of them are unsatisfied with their tooth color. Tooth whitening offers an easy and cost-effective way to treat dental discoloration. Based on the recently published market updates, one can clearly see that there is an increasing popularity of such treatment. But, as with every procedure, tooth whitening also has its flaws. Most of the in vitro studies report reduction in the organic and mineral component, which results in the reduction of microhardness. So my aim is to determine the change of microhardness after bleaching, which leads to my clinical question: how the different teeth whitening methods will influence the microhardness of human enamel in vitro. My population is natural human teeth. I would like to compare whitened enamel with non-whitened enamel, and the outcome will be Vickers microhardness number. My hypothesis is that Vickers microhardness will decrease after bleaching. The clinical implication of my study is to determine the effect of teeth whitening and possibly to raise awareness of possible harms of such treatment. On this slide, you can see my systematic search based on the search key. You can see on the board. The date of search is 5th of November, and you can also see the number of results that I received in the 4 databases. Now I would like to present to you my key article. The first one published in 2015 in the Q1 ranked Journal of Operative Dentistry. I would like to give you a brief review about how these experiments are carried out. After the extraction of teeth, they embed them in acrylic resin and then they polish them. After that, they do the bleaching according to the manufacturer's instructions. There is a surface microhardness measurement before bleaching and after bleaching, and they compare the results. According to the results of this study, I've also created a bar chart for you to emphasize the importance of my topic. With purple, you can see the Vickers microhardness before bleaching, and with gray, you can see that as the hydrogen peroxide concentration increases, the Vickers microhardness decreases. The strength of this first key article is the large number of specimens. My second key article, published in 2022 in also the Q1 ranked Journal of BMC Oral Health. The strength of this key article is the randomization of samples, but the limitation reported that the bleaching was carried out in a single session instead of successive weeks. My third key article, published this year in also the Q1 ranked Journal of Operative Dentistry. The strength of this study is that various concentrations of bleaching agents were used, and also morphological analysis with scanning electron microscope was done. I would like to underline here that all of my key articles are published in Q1 ranked journal, which I think gives a really strong base to my research. On this slide, you can see the number of results that I received after duplication removal and title abstract selection. Currently, I'm in the phase of full text selection. And now I would like to present to you my second project, evaluation of the effectiveness, safety, and satisfaction of tooth whitening in vivo, which is a comparison again of in vivo studies by the methodology of systematic review and meta-analysis. The background is quite similar. The patients are still unsatisfied with their tooth color. They still want to treat it by the methodology by the teeth whitening, but there are safety concerns that are uprising. Most of the in vivo studies report tooth sensitivity, which can even hit the prevalence of 93% among patients. So what we can tell the patient that most of the time these flowbacks will occur. However, we cannot tell them how much will they benefit from the treatment. So my aim is to determine how much a patient can benefit from teeth whitening treatment. Which leads to my clinical question. What is the benefit of tooth whitening in terms of effectiveness, safety, and satisfaction? Effectiveness is measured by the shade change. Safety measured through visual analog scale, and satisfaction is measured by a survey that the patients fill out after the treatment, based on how satisfied are they with their new tooth color. My hypothesis is that effectiveness, safety, and satisfaction so the effectiveness and safety is low compared to the occurrence of complication. My clinical or research implication is to determine the cost-benefit of teeth whitening. So on this slide, you can see the summary of my results. Again, the first one is investigating teeth whitening by the comparison of in vivo studies. The second one is a comparison of in vivo studies. The planned submission days are 2024 in May and September. And I would like to thank you for your attention with a quote of Stefan Bergen. Color may be unimportant to the physiologic success of dental restoration, but it could be a deciding factor in patients' acceptance. Thank you so much.
How do you use the visual analog scale for side effect? Or what you use some other expression, I don't remember. What was not side effect?
Safety.
Safety.
Yes.
So because usually visual analog scale using for aesthetic or pain.
Yes, we use the visual analog scale to measure the tooth sensitivity. It is a scale from 0 to 10 where the patient reports how much sensitivity or pain he or she feels after the treatment.
I would like to ask the question regarding your second project, because as I know, after the whitening of the teeth, the sensitivity grows, and you mentioned that in your background, but you're not planning to check it in your study because in your outcomes, I didn't.
Yes, as I said earlier, I would like to measure tooth sensitivity by visual analog scale. So the patients report, it is a scale from 0 to 10. If the pain or the sensitivity, so if they feel low pain, which means basically sensitivity, they give a low number, close to 0. If they feel a high number of pain or sensitivity, they give a number close to 10.
Are these teeth extracted? And if yes, then where do they get these teeth from?
Yes, thank you so much for your question. The teeth are extracted before the bleaching experiment. They are extracted due to orthodontic reasons, or they are wisdom teeth, or maybe because periodontal reasons. That's all that I can say.
And are they human teeth then?
Yes, of course, yes.
In clinical practice, there may be after 2 or 3 periods of bleaching, there may be like no further response of the teeth, and maybe switching to veneer. So is that true? And what is the reason that maybe hydrogen peroxide saturation or increase like hardness after multiple periods of bleaching? So
the studies reported, which done like multiple bleaching, none of them reported that there is an increase in the microhardness. So
like maybe
I don't know if I answered your question.
Like it might be the reason hydrogen peroxide saturation, or like why the tooth not respond any further after several periods of.
I don't think that. I think what you're referring to, that maybe it can cause the necrosis of the teeth, or maybe, but I don't think that it's the case. If it would be the case, the patient would feel so much pain that the patient won't choose teeth whitening if they feel so much pain.
Did they define the baseline of characteristic of the patient by the sensitivity, because that could matter if someone has already sensitive teeth and after the bleaching it's going to be even more sensitive, or how did they manage this?
Most of the patients who are involved in the study have no carious lesion, no teeth sensitivity whatsoever, so they try to do not include them in these studies.
Just because of the European regulation, I couldn't find any evidence that why they banned the high percentage of the tooth whitening. So it would be very nice to really include those safety which the European Union referred to it, because then would persuade me that why they ban it. Okay.
Yeah. Thank you very much.